again. Week number 8. Yep, week 8. So, gonna show off now. Yeah, Sam, say, low chat, bat, 8. That was Cantonese. Mandarin? Cantonese. No, that was Cantonese, I think. 1 to 8 in Cantonese and showing off. Anyway, here I am, week number 8, here for my PICC line and bloods. So, yeah, I like get my PICC line done because 1, it's nice and easy, it's very quick, and 2, gives you PICC line a little bit of time to breathe because you have this thing on all the time, and it has a super sticky dressing, obviously, because it needs nothing to move. So when they peel it off, it's lovely. Your skin breathes for a few minutes and they clean it with nice cool wet antiseptic, and yeah, and then they slap another new clean dressing on. But for a few minutes your skin gets to breathe, so it's lovely. Obviously bloods, just to make sure I'm okay for chemo tomorrow. And yeah, here we go, number 8, ticking the weeks away. Woohoo! Not too bad this week with side effects, the usual spots, but I had them with my makeup, but they are a nuisance. No sooner are they going and it's nearly time for chemo number 2. I tend to get the spots more than a rash, although I do get a rash a little bit as well. But yeah, I think that's the annoying thing for me that I'm having each week. I get odd little things as well, but nothing major. Like sometimes I'm super tired, I need a nap. Midday nap, what's wrong with that? Maybe a bit bloated sometimes. You get, like, I think they call it chemo belly, I don't know why. I don't know what causes that. But I get that a bit. A slightly runny nose because it affects my nose. Sometimes it bleeds a tiny bit, but yeah, I've been lucky, nothing too major. So yeah, here we are, week number 8. Still haven't washed my hair, so yep, it's minging, but I don't care. Yeah, don't care. I think your hair gets to a certain point. You don't wash it for ages, it gets to a certain point and it just stays like that. So do you know what, it would probably stay like this if I left it for weeks. How gross. But I was talking to a girl the other day and she only washes her hair once a month. So she's not having chemo. She says her hair just never gets dirty and she washes it once a month. I thought that was I didn't think that was possible. Normally I wash mine twice a week. Then I went to once a week with the chemo, and then I thought, frig it, I was leaving it longer and longer. So yeah, I think this is long, but here we are. I'm gonna have to go in because, yeah, the car's getting hot again. As you can see, it's a lovely sunny day, but that means the car gets super hot super quick. So yeah, I'm gonna go in and start off week number 8. Week number 8, that will be 2/3 through, 8 out of 12. 2/3 through after this week. Oh, yes. Oh no, that's tomorrow. I thought I had an oncologist appointment, forgot all about it, but that's tomorrow after my chemo. Okay, right, I'm heading in, so bye for now. Catch you on the next one. Here I am, PICC line done. Quick and easy. I love those appointments. Sounds a bit sad, but I do. I love them. They're just quick and easy, simple, easy appointments. In and out, job done. Last time I used to hate getting my bloods done, but now with the PICC line, it's a doddle, honestly. Chemo like totally wrecks your veins, so it's a nightmare whenever I have to give bloods now. Since the last chemo, it's always been torture. I used to dread getting my bloods done because they have to really dig and hunt for a vein. But yeah, with the PICC line, it's brilliant. They just plug it in, draw the blood out. It's just easy peasy, no digging for veins, which is torture. So I'm just chuffed. It'll be a shame when this is out, because, well, it won't be a shame because I mean my chemo's over. But yeah, after that I'll be back to the usual way of getting bloods, which is a nightmare because my veins or ruined because of chemo last time. Corded, ruined. Yeah, so yeah, here we go now. Here I am back at my second home at the hospital again, for week number 8, chemo number 8. So yeah, brilliant. Number 8. Getting that done today, and then I have an oncologist appointment after that later this afternoon. So all in all, I will be here. What time is it now? Gosh, I think I'll be here about nearly 5 hours today. Yeah, at least 4 or 5 hours. It's 11:15 now. My appointment's 10:30. Usually at chemo 3 hours or just a bit over, and then I have an oncologist appointment straight after the chemo at 3:40, 2:40, no 2:40. Yeah, so I think I'll be here yeah, nearly 5 hours today. Long day. So not much to say since yesterday, other than I am going in, getting number 8 done, and boy will I be happy when that one's ticked off too. Woohoo! 8 ticked off. 8. Only 4 left after today. So yeah, I have taken my 2 paracetamol already, and I have got my cap to throw on when I come out. I've got 2 bottles of water. I leave this one because it's a flask one. I leave this in the car, and I take just a normal bottle of water in with me. Oops, sorry, that's a tissue. In with me. So obviously you get hot drinks and all that in there. You can probably get water too if you ask, but I just take a bottle of water. I have a drink whilst I'm in there, a hot drink. But having a hot drink whilst you're having the cold cap is nice. So I'll have like a soup, or sometimes a soup and then a coffee a little while later, or a hot chocolate or something, because yeah, it's just nice whilst you've got the cold cap on anyway, because obviously you're cold. But I take my water in, and I try my best to drink as much water as I can chemo day and the first few days after chemo, obviously just trying to flush whatever poisons, toxins, whatever out. So yeah, I usually drink this the whole time I'm in the hospital, and then when I come out, get back in the car, I have this whole bottle which I drink on the drive home, and then obviously I drink as much as I can in the day once I'm home as well. So yeah, that's another thing I like to do, drink as much water as I can. So yeah, not much else to say right now other than get in there, get number 8 done, and tick that one off the list. Yay! Bye for now. Oh, and I've got my comfy blanket, my super soft comfy blanket, which I take in every week, which keeps me nice and cozy and snug, because 1, you get a bit chilly having the cold cap, 2, I get sleepy sometimes with the pre-med, so yeah, it's just nice and snuggly. And I put my feet up, because those chairs that you're in, they have it, you know, where the feet come up, so you can just push back and chill whilst they're pumping you full of toxins, full of chemotherapy drugs. Bye for now. I've just had chemo number 8, and after that I had my oncologist appointment. Chemo went fine, just the same as always, no problems. Oncologist appointment was running late, very late. My appointment was at 2:40, but they didn't call me in till 4:10. 4:10. So my oncologist appointment was an hour and a half late. To be honest, the oncologist appointments are always late. They're always running late, which is no problem. You know, it is what it is. But that's been the longest. I think that is definitely, that is definitely the longest I've had to wait for an appointment. An hour and a half. I think normally an hour is normal, but yeah, that was long, an hour and a half. But anyway, got in there, seen the oncologist, all fine. Just checking up on everything, how the chemo's going, how my, you know, results are, what happens next about the radiotherapy. It does look like I will have a nice gap between chemo and radiotherapy, so I might be cheeky and squeeze a little holiday in. I think it could be four or 6 weeks between the end of chemo and the start of radiotherapy, so I'll see about that. Maybe I'll book something. And I will be having 3 weeks of radiotherapy. So yeah, that's not too bad. It's every day, but for 3 weeks. It's a bit of a pain because it's every day, but the treatment isn't too bad. And last time my radiotherapy was 6 weeks, so it was every day for 6 weeks. So this is a huge difference. This is it's great. It's half the time. So that's a positive bonus for me. Only 3 weeks instead of 6 weeks. I also, they got the results of the genetic testing. That's it. Chemo brain. See, chemo brain. Duh. So got the results of the genetic testing, and everything came back negative. Because we'd already had the BRCA1/2 testing ages ago, and I was negative then, didn't have it. They did more genetic testing this time because they're like, what the frig, why is it back again? We thought there might be other things going on. They've since had, you know, do tests and know a bit more about some other genes. And guess what? All negative again. So this time it's R208 that they check, which is, I think it's another 3 or 4 genes in that group, like check this or check whatever. But anyway, that was negative. So yeah, in one way that's great, because I think there's no risk to my daughter, you know, there's no risk to anyone else there of passing anything on, or her risk being high because of whatever's made my risk high. So it's good news for that reason. But anyway, it's not so good because I'm still like, what the heck? Why am I getting this darn cancer twice? Which then makes me think, can it come back a third time? So obviously I asked her a few questions, but they don't have the answers. They really don't know. She just said, I've just been very, very, very unlucky. Can I be very, very, very unlucky a third time? I know when I asked last time, the HER2, that's what my breast cancer is, HER2 positive and ER positive, which is hormonal. And it was the same last time, but the hormonal part of it was 100% last time. This time it's lower. I think it's 50% this time, but the HER2 is the same. So although it's hormonal, it's less hormonal this time round. That's why I can't have HRT or other things that I can't do. But the cancer, the second cancer, is less hormonal receptive this time. But the HER2 is the same. The HER2 is like a protein in your cells. And it's in your heart cells as well, which is why they have to monitor your heart. I have to go for another ECG soon. You have to get them done every 3 months. So yeah, when I asked last time about the HER2, she said, well, 95% of people with HER2 breast cancers, it doesn't come back again, or they don't get another one. So obviously I'm in the unlucky 5%, which I think, darn it. There's no reason why, because there's no other genetics or nothing else going on that they know of. So I think, so what now? What's the chances of someone with HER2 a second time getting it a third time? Is that another 95% of people who've had it twice won't get it again, but 5% will? Will I be in that darn 5% again? Oh God, what do you do? What do you do? Other than check, check, check. Keep checking all the time. And just be vigilant. The problem is it never goes away. It's in the back of your mind all the time. But take the positives, because I have done 8 chemos, 8 out of 12. So that means I am 2/3 of the way there, nearly getting to the end. So that's good. It went fine, no problems, and my genetic test was negative. So that is good, because the last thing I want is something wrong with me that I could pass on, that could have been passed on to my daughter. But you know what? That's my phone ringing. So I think I will say goodbye and answer my phone. Bye for now. That was my auntie calling me for a checkup, how today went. So yeah, answered. I was just explaining to her then about the genetics coming back negative, which is I don't really know what to think about that, really. I am glad it's negative, because whatever's going on, that's not affecting us, so I'm not going to be getting anything that could be related to that again in the future. And like I said, the #1 take from that, which I am 1,000,000% relieved about, is my daughter hasn't got, you know, if I've got a genetic default that's causing this breast cancer, then she hasn't, because I haven't got anything that I passed on to her, because that was always my worry with the with all this, is if my daughter's, what risk she'll be at in the future. And for those who don't know, the last time I had the breast cancer, we had the BRCA gene testing, and obviously it's BRCA1, BRCA2, and our family have the BRCA2. It came out that we have the BRCA2 gene, but I don't. I tested negative, so I don't have the BRCA2 gene. They were all expecting, even in the genetics clinic, everyone was expecting my result to come back positive, because I was the one who had breast cancer at a young age. Nobody else in the family had breast cancer. So we did the genetic testing, all expected mine to come back positive, and I came back negative. Obviously some of the family did come back positive, and they have since had preventative surgery, which is double mastectomies. A few of my cousins have had a double mastectomy. Some have had ovaries removed as well. This is all the preventative surgery that they offer you, you know, if you've got the gene, because obviously quite a few of them tested positive. I tested negative, which everyone was surprised at, even me, even the family, even the genetics clinic staff. But in a way I was relieved. I was glad, because it meant I haven't got a high risk of whatever else, ovarian cancer and whatever goes with that. And I was, again, because of my daughter, I was just 1,000,000% relieved because of that. Because if I had the BRCA2 gene, the chances that she could have it obviously was a real problem. But I haven't got it, so she won't have it, and that's what I was relieved about, because what they tell you in the genetic clinic is that the BRCA2 gene, it doesn't skip a generation. So because I haven't got the gene, my daughter won't have the gene. Do you know what I mean? Like, I've got the gene because my mum had it. She tested positive for the BRCA2 gene when we got all the testing. Obviously, one of my sisters tested positive for the gene. I tested negative, but it doesn't skip a generation. So if my mum had it and I don't, then there's no risk to my daughter, because it doesn't skip if I haven't got it, that's it. It doesn't get passed down. So that's a massive thing, a massive relief. Anyway, it's wrecking my head, so I'm going home. And I'm sweltering in the car again. I'm cooking. So I'm going to say bye for now. This will probably fester in my head. I'll be thinking about it later. But it's good, really, because I haven't got any genetic mutation that they know about. And that means my daughter hasn't got any of those genetic mutations that they know about. So there you go. And I now only have 4 chemos left. So bye for now. I need my AC on. Bye.